Good evening, everyone, and thank you so much for joining us tonight. Before we get started, I'd like to read this brief disclaimer that is currently on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now with that out of the way, I would like to say thank you again. Welcome to the program tonight. My name is Craig Orpello, and I will be your host tonight. And you are here joining us for the PharmAssist Virtual Learning Experience, an educational program that was created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place every Monday evening at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A session throughout the program, where you come in, because if you're joining us via Facebook or Zoom, you are invited to ask us any questions you may have. You can be part of that discussion, and you can throw your questions into the Facebook chat or directly into Zoom via the Q&A or the chat there as well. And we will be able to answer those questions as we move throughout the program. So what we do is we have various HCPs that can join us every single week from across the nation to provide you with a real world experience, just as if you were sitting across the table from them in the clinic, asking questions and so forth. So I would like to say that today we are very lucky to be joined by Wanda Hofgesang. And so I will say thank you so much for your time and interest this evening, Wanda. And I now want to turn it over to you. Take it away, Wanda.
Hi, Craig. Thank you so much. I'm so happy to be here tonight for the virtual learning experience with Mandel's Pharmacy. As Craig stated, my name is Wanda Hofgesang. I am a registered nurse in the infertility reproductive medicine world here in northern New Jersey. I work for a clinic here. And teaching has always been a big part of what we do as fertility nurses. And I know that's always been one of my favorite aspects of reproductive medicine. There's so much terminology. And so our goal really is to try to make the confusing feel not as confusing, and to try to help disparage any beliefs that you might have in regards to your fertility cycle and maybe making a mistake and having it be an issue for you. So the great part about this program is to showcase 3 products that could be a part of your fertility cycle. This evening, what we're going to be showcasing is 3 medications. One is called Menipure, another is called Ovidrol, and the third product that we'll showcase is the Gonal-F multidose. What I'll just say first about that as well is that which products that you might be on for your cycle is really based on your clinic, your physician. Although fertility patients are all in a fertility clinic, you are all individuals when it comes to your treatment plans. And so each of the clinics will take a look at your diagnosis, your history, your background gynecologically, and they'll come up with some medications that'll be a part of your fertility cycle. So even if these medications aren't a part of yours, but some others are, what I also want to let you know is that, like this evening's live event, it is being recorded, so it will be able to be in a video library at mymandels.com PharmAssist, and you are able to look at any videos that have been done in the past as well. I've been here before and have done other products, so don't want you to worry if something here, you're wondering if there's another video for another one of your products, because it's in that video library, so feel free to take a look at that, and that's really important to know. The other thing is we are going to have a wonderful Q&A session live. So how the format will work this evening is each of the products you will see a video that'll go over the medication preparation, administration, and injection technique. These will be videos that I will be in these videos for you, showing you the different products. And then once the video is completed, you're going to come back to me here live with Craig, and we are going to entertain any questions that you may have. We'd like you, if you can, to make sure that any questions that you're asking, that you focus on the product usage. Anything that becomes a little specific, we might have to refer you back to your healthcare provider, your team, your clinic. because we're certainly not here to replace them. They are of a value to you, but we are here to be of help to you in the process of getting through that medication cycle. So the first product that we are going to showcase is, as I mentioned, a medication called Menipure. I have a little demo box here. And if Menipure is one of the medications that you are taking, you will see that this is something that is part of the follicular recruitment phase within your fertility cycle. So with most fertility cycles, the goal is to have you produce and develop more than one follicle, which contains an egg within the follicle. And that's really the goal of that medication, is to help you recruit and develop multiple eggs. So there's a lot that'll be covered in this video. Menipure is one of the medications that I will just say that does require some mixing. Not all medications for fertility do, but this is one of the medications that does require some mixing. So this is a great one to watch. And again, you'll be able to replay it via a video if you'd like to go into that video library again. It's available to you every time you need to take that product, and you can go in and watch that video. So without further ado, I think we'll have Craig bring up that video for us of that Menipure. This video is to help you with the mixing and administration of your Menipure injection. Menipure will come to you from the pharmacy in a box, a couple different boxes. They may be a little bigger than this, but this is right now what the box looks like, just in case you're wondering what it looks like and you have it at home. So you want to get that box from your safe place. It does not need to be refrigerated, so you may have this just in a cabinet, which is great. That's fine. If it's in the fridge, it's not wrong either, but it doesn't need to be in the refrigerator, just so that you know. The supplies that you'll need from, oh, nope, I'm going to rewind that before I jump ahead of myself, just to let you know what Menipure is. Menipure contains the hormones of FSH and LH, and both of those hormones work in harmony with our body, again, to help with recruitment and development of multiple follicles, which turn into multiple eggs for possibly insemination or for IVF retrieval. So the Menipure is FSH and a little bit of LH. And we have both of these hormones in our bodies naturally. And when we're administering these into our bodies via an injection, it's putting a little bit more into our system to help us recruit several eggs and mature eggs, which we don't normally have several mature eggs during our natural cycles. So that's really just that's the goal of it, just so you're wondering, why am I taking this? And that's always important to know the why. I think it helps you to understand. The other part of Menipure is, where do I inject it? Menipure is injected into either the lower belly, lower abdomen, or the upper top, upside outer thighs. That's routinely where we have our patients doing that injection for the fertility clinic I work with. And I think most often that's where most everybody is as well. So the injection goes in the lower belly and or the upper outer thigh, which is a subcutaneous injection. So those injections, you have an option of either self-injecting or someone gives you the injection. And that option, again, is yours. It's not one that it should be your individual choice to figure that out. We want you to feel comfortable with administering this medication. So if you are able to administer your own medicines, great. If they concern you to do that and you want to enlist the help of a significant other, then that's fine too. Do whatever makes your fertility cycle journey the most comfortable for you. So with regards to Menipure, where the supplies that you will need for that is going to be, you will need vials of Menipure that contain a powder or a tablet or a wafer. You know, everybody refers to that a little differently, even amongst nurses, but just so that you know, you will have little vials that'll have a powder or a tablet, and that will be what's in this box that you have of your Menipure. And you will also need to have a Q-cap, which is going to be supplied with you as well. Pardon me for having that upside down, Q-cap. So you need one of those for this medication. You also will need a 3 cc syringe. If it has a needle on it that is long, then you are going to remove the long needle. Just depends what you might get from the pharmacy. They may send you a syringe without any needle in the package, and that's great. That's what you need, because this is a 3 ml, 3 cc syringe. But if it has a needle attached that's very long in length, remove that needle and discard it in your sharps container, because you do not need that long needle for this. Remember, I said this is a subcutaneous injection, which anytime you hear that buzzword or a belly or a thigh shot, that means that it's a tiny injection needle that you will be using to inject with into your body. And then lastly, what you'll need is a 1/2-inch needle. The pharmacy might send you either a 27 gauge or a 30 gauge. Just so you know what those 27G and 30G mean, the higher the number just means the thinner the needle. So the idea here is oftentimes for subcutaneous injections, most commonly it'll be a 1/2-inch needle and a 27 gauge, and usually that has a gray outer little labeling system on it when you get it. Once in a while, the pharmacy might send you a 30 gauge, and that's fine to use too. So there's flexibility with some stuff, and where there is, we want you to know it's okay. But if you're ever confused or you ever have a question, obviously your nurses at your centers are always there to help answer any of those questions that you might have about your Menipure supplies. So once you get your supplies, our next thing is to, again, mixing and administering a medication is not a sterile technique, but it's a clean technique. So it's a good idea to wash those hands, use a little hand sanitizer if you're not near a sink. I'll just use the hand sanitizer for showing you to make sure that you do know that it's always good to clean those hands. And when you have everything set up, then you're ready to go. So the first thing that we would do with our Menipure is we would have to know our dosage. Your dosage that you might get from the nurses, they may refer to it as you're going to mix 1 powder or 2 powders or 3 powders. We just find sometimes it's easier for patients to understand that, since the 2 types of vials you'll have are powder and or water. So what you want to know is that she will tell you how many powders, but she may also give you a number. With Menipure, each powdered vial is equivalent to 75 units. So if you're a patient that's taking a 75 unit dose, you're mixing 1 powder. If you're a patient that's taking a dosage of 150, you're mixing 2 powders. I think the other thing I've always gotten asked about that, is it 2 shots? Nope, it's not 2 shots. It is simply 1 injection, but the strength of that shot is 2 powders. So that's what's important just to know right off the bat. Don't worry or get concerned or panic that you have 2 shots because you're doing 2 vials. It's 1 injection of Menipure, but your dosage could be a little less or a little more. And what determines that is your doctor at your clinic, based on your history, your diagnosis, and your plan, your age. All of these factors go into effect in coming up with a protocol of which medicines, what dosages, etc. So if my dosage, and I'm going to show both. If I were 75, 1 powder, or 150, 2 powder. So first off, what I do is I take these little plastic tabs that are on top of these vials and I remove them. Okay. Under there, it is sterile. However, like I say, the nurse in me is always wanting to clean the surface of anything that I'm sticking a needle into. So I'm going to clean the surface of these vials for us so that we get ready for our mixing. So we'll clean them, put them down. The next vial you will have is a vial of sterile sodium chloride. You take off that little cap. Once again, get a little alcohol prep pad, clean the top of that. So first thing you're going to notice is I'm only taking 1 vial of water. The ratio, how I always say it to patients, no matter how many vials, how many powders, what number Menipure you're mixing, always 1 vial of water, sterile saline, sterile water, to however many powders you need to mix. And it's always 1 shot. That's the key. So 1 shot, 1 water, but the variable is the number of powders that you need to mix for your dosage. And that dosage could periodically, potentially through your cycle, need to be changed and adjusted based upon your response to your cycle. So just know that this is a variable, but your nurses will guide you every time in telling you what you need to take and how many vials you're mixing. The next step is going to be to grab your syringe, and you're going to open up your Q-cap package, and you will twist your Q-cap onto the syringe. It threads right on there and it twists. Our next step is going to be that we're going to go into this vial of sterile water. Okay? In the vial, we're going to draw up 1 ml. There's a little pressure in that vial when it's new, and it can make it a little difficult sometimes to draw down. The pressure will push on the plunger. So a way to handle that is if whatever you're drawing out of the vial, you inject that amount of air, it'll help equalize that pressure. So draw back to the number 1, lining up the rim of the plunger just on that number 1 line. The Q cap just gently pushes down on the top of the vial. Turn it upside down, and you'll see when I push, it's going to bubble. And then when I let go, you're going to see that it pushes down on my plunger because of that pressure. But eventually it stops because I did that little tip of adding the air. So what I want to do with this vial is I want to draw up 1 ml. So I would draw down to the number 1, filling it up with 1 ml. One thing to let you know about your Menipure is you will always have extra water when you draw up the 1 ml because they put 2 mLs per vial of sodium chloride sterile saline. So what you want to know is if there's extra water in here, that's okay because you're only drawing up to the 1. Once you draw up to the 1 and you have it in the syringe, just wiggle that vial off and discard it. Do not save these sodium chloride vials, not necessary. You have enough in your supply with your prescription. So that can go in regular trash. You will take your first of your powders, attach the Q cap, push down on the liquid. When that water hits that powder, it's like cotton candy hitting your mouth. It melts. So that little powder and that little wafer just dissolves. You can roll it around gently, but don't shake. You just want to reduce the bubbles. So you gently roll it around, keep the needle attached to it. Once it looks like it's all mixed, you're going to drain all the way down to that 1 ml. So I'm going to drain all that fluid that I just mixed in there, which is 1 ml went in, 1 ml comes out. Now this vial is empty. I do not save it. There's nothing I need it for. So I will once again toss in my regular trash. If I were doing a dose of 75 units, 1 powder, now I'm actually done. I do not need to mix anymore. I would take this Q cap off and attach my injection needle. But because I want to show you also how to mix 150, if you're doing 75, you would take the Q cap off after mixing 1 vial and we would put on the injection needle. But if we still need to mix 1 more vial because our dosage is 150, 2 powders, then we're going to keep that same syringe with that same liquid, which has one of the vials of Menipure dissolved already, and push both powders together now with that 1 ml. Roll it around, let it mix, draw it back up. And here's where, when you're done with your mixing of your number of powdered vials, all you need to do is twist off the Q cap with the vial, and that can go in regular trash because no blood has come in contact with that. You will then take out your little 27 gauge half-inch needle to inject. If I had any bubbles, I give a little snap to the syringe and that helps the air rise to the top. But if I don't do that step, is there anything wrong? Absolutely not. And I just want to help you right away because this is a mixing medication. Please don't panic about air. Air is more of a concern when you're in a hospital and I'm taking care of you and you have an IV going directly into a vein. Yes, air if you can, and you see a little bubble, you can always flick it. But there will be some little air bubbles you can't remove. And I don't want you to start pushing the medicine and letting it squirt and you're losing valuable drug. So the little bit of air is never going to hurt that little fatty tissue, FYI. Just know that so that you don't worry or panic if you have an air bubble there that won't move. Like I mentioned in the very start of the video, the injection area that we used for this is our lower belly or the upper outer thigh and top thigh. So all in here. And with Menipure, because you will take it more than 1 injection, you'll do approximately 7 to 10 of these injections. It's just good to know that you can move around in that belly every time you give an injection. You move it around a little bit. You could then also incorporate using the thigh and do the thigh as well. So some ladies will do just belly shots. Some ladies will stick with their thighs, or some ladies might combine both. No right or wrong, whatever works for you is fine by us as long as the medication, you have the right dose and the right area that you're injecting. With this medication, like I said, you could self-inject or somebody could give you the injection. So if somebody's giving you this shot, you could lay down. And when they're giving you this injection, the needle goes in at a 90-degree angle in your belly, a 90-degree angle in the top of the thigh, and a 90-degree angle into the side thigh. It's a 90-degree angle. If this were me right now and I'm standing and I'm giving my own injection, if you do give your own shots, which you can, then standing up, the injection 90-degree angle is just like this, the angle straight in. So what we do to get ready for that injection is we clean the area with a little alcohol, just clean that skin. Next step's going to be to pinch and have a little bit of fat. With pinching, be careful that you don't over pinch. I'm just going to show my arm here. When you pinch that fat, lift it a little bit gently. Don't squeeze and grab so tight. If you do, you might bruise, and you just don't want to have a bruise there. If you do get a bruise, some people can bruise from an injection. Don't worry. Just avoid going into the bruise when you give a new shot. It's not uncommon or unusual to bruise when you get your blood drawn or even given a little shot. Not to worry. It's just you want to avoid going into a bruised area to further cause any trauma to that area. So what we do here is we uncap our needle, gently pull it off. We're going to give that little pinch to the skin here. The needle goes in straight in. We do not need to jab. Once we put it to the skin, we're going to give a little push and it goes all the way. We let go of the fat and then we push that liquid right in. And then can do a 1, 2, 3 count. Remove the needle. And then what you want to do here, guys, is if your sharps container is nearby, you don't have to recap a dirty needle. You can put it right in the sharps container and then put the cap in there as well. But I'm just going to be safe for me right now and just cap it so I don't have a dirty needle lying around since I don't have my sharps container. But you would put this into the sharps container. With Menipure, you're never reusing any of your supplies to the next shot. Every night you do a shot of Menipure, you gather new supplies and you use all of those supplies up, and then the next night, new supplies. So nothing is ever left over with a Menipure shot. One last little thing I will mention about a Menipure injection is sometimes you may feel a stinging sensation when the liquid goes in, and there's nothing that you did wrong with that. They do use sodium chloride to mix the powder to dissolve it, and sometimes that's just a little irritating to the fatty tissue because we have a lot of nerve endings there. So if you ever feel a little sting, don't panic with a little tiny injection. You've got a lot of, think of a paper cut. Even though it doesn't sometimes go very deep, a paper cut's really sensitive when you get it because of all those nerve endings in that little fatty tissue. So same with the belly. It'll be very fleeting when you feel it, but when that medicine goes in, you definitely can feel a little bit of a sting. And if some of your other medications didn't have that sensation, you might question, did I do this right? And I just want to reassure you that indeed you did mix it correctly. It's just that that's the nature of that medication sometimes when it goes into the body. So I hope this video is helpful for you, and hopefully you will get started with your Menipure and be successful with your mixing, but certainly understand, give it a little bit of time. The first night's the challenge, and then after that you'll become a pro at your mixing of your Menipure. As I was watching that video, I just noticed one thing I wanted to comment on is when I had that needle in there and I showed, the administration, I just wanted to say that usually after the needle goes in and delivers the medication and you remove that needle, just have a little cotton ball there and put a little pressure. You shouldn't get a lot of bleeding after this injection, but sometimes I know I get comments from patients like, ooh, was it bad if a little blood comes out? And I would just want to reiterate that, as I stated in the video, that you just have little capillaries in your fatty tissue. So when you do go in with a needle and you come out, sometimes there will be a little blood that will come out, and that's perfectly okay. Just put a little cotton ball to it for just a couple seconds. The other thing is sometimes you might see the medication come back out, or I should say a little clear fluid, and patients think, oh, am I losing the drug? You're not going to really lose that with that 1 or 2 drops, but I just realized in showing that, I show in the other videos to usually hold a little cotton ball, but picked up on that with my own video. So I just wanted to reiterate to you that after you take that needle out, you just put a little pressure there. But with the subcutaneous injections, there's not too much there that you're going to have lots of bleeding or anything after the injection. It's not very common. So wanted to just mention that myself. But as you can see with the mixing, this drug it's not that difficult once you get that steps down. And then with this medication, because you take it more than one night, by the time you're done that first evening, I promise you become a pro at it with your own, you develop your own routine when you're taking that medication. So I think like anything, the first time of doing that is the challenge. And then once you get the confidence of, hey, it's not so bad. And I really have to say that most of the patients will comment to me, it wasn't as bad as I thought, the mixing. It sounded complicated when you explained it, but then when I saw the videos, it was really helpful. So again, I think the video for this one is extremely helpful to have handy and to watch it before you start that Menipure, because I think it just helps give you that confidence. And the first night for sure is a confidence booster as well. Craig, I don't know if there are any questions that anybody has out there that we can answer for them.
Yeah, absolutely. So again, it's good to see you. And thank you everybody for joining us tonight. We appreciate it. And just a couple of quick things. Again, all your questions, you can put them, if you are joining us on Facebook Live, you can put them directly into the chat. If you're joining us in the Zoom, you can write directly into the Q&A or into the chat section. Either way, we will get a hold of those questions for you. And we take all questions, so feel free to pile on and bring them on, like this question that just came. So you did touch a little bit on this, and so I want to, I want to see maybe kind of if you can add a little bit more to it. But we always get these questions about side effects. People want to know what to expect. It's part of what the PharmAssist program is great for, is to get an understanding of what you're in for, get beforehand. So you kind of know, you can get all the potential jitters and all that out of the way beforehand. So when you're ready to give that shot, you're already, like you said, a pro. And so the question that comes in says, what are the normal side effects associated with Menipure, which you did touch on a little bit, but how can I minimize any pain or discomfort from this shot?
Usually what we'll say is sometimes you can use a little bit of ice to the area. The main thing with subcutaneous injections, because it'll feel, how I equate that injection and what you feel is if you've ever had a flu shot or anything like that, and you've had blood drawn where they've made contact with your skin when that needle first goes in, it's a little pinch. Even getting blood drawn is a step more advanced than a subcutaneous injection, which usually by the time you are then doing your Menipure shot, you've probably had our blood drawn, all of us, whether it be fertility or even for our general practitioner, we've had our blood drawn before. I'm not saying we love it, but what I just want you to know is that it's even less invasive to give a shot in your fatty tissue than it is to have a needle go into your vein. So that I just like to mention that because I think then that can be a confidence booster to not worry, but it'll feel like a little mosquito bite pinch. If you don't want to feel that, on some occasions your clinic might say it's okay to put a little bit of ice there, a little time frame of ice. You don't want to use ice too long though, because you want to leave the little capillaries freely to allow that medication to absorb through your fatty tissue. But there are sometimes some products also out there that if this is a big issue with you with getting blood drawn or injections, there can be some lidocaine-based products. One of those is Cinera that we do have a video on that your clinic might be willing to order for you if that would help you. And it's a numbing type of patch that you would apply prior to administering the shot. And it can help just that area, numbing it a little bit, sort of what ice does, but this would be an actual medication. It would be another prescription that would be handled through your clinic to call into the pharmacy. But those are ways in which we can help you with that. And the only real thing with Menipure, as I did mention in the video, is you can get like a little tiny sting. Sometimes if you don't use the lidocaine patch, you might feel that. And it's very fleeting, but it's just like a little quick sting of the solution. And sometimes you can rub that, massage at the area a little bit just to help, if that would help it feel better. And a lot of times patients will use that little technique to help it feel better.
Perfect. Thank you. And I think one of the things that definitely helps is for people, like you said, to understand that you are going to be taking a number of different shots throughout this process. If you're brand new to this and you're really just trying to get comfortable and prepared for that, then we totally understand. And that's really what we're here, is to just let you know when and where there may be things that you can potentially prevent in advance or know about in advance, so you can be prepared, so you're not caught off guard. So it's great when you're able to really kind of put things in perspective and say, like, hey, this one's going to be a little bit more like just a blood draw or something like that, which is something you'll be well versed with by the time you get to this point. So it's great to know that, people were hoping, again, to put all your minds at ease now, so that when that time for that needle comes, there's no shock or there's no surprise or anything like that. So thank you so much, Wanda. Appreciate it. So another question that comes in, and we get this every single show. There's always some people want to know about the minutia of the individual shot itself and how the shot's going to be given. Other people want to know in the bigger picture of how's the medication working. And this is that type of a question. And it comes in saying here, so what does the Menipure again actually do in my cycle? I just want to know, what is the reason for using Menipure instead of just using FSH alone?
Prior to ovulation and in our natural cycles, we have two hormones. They're pituitary hormones that are secreted, called follicle stimulating hormone, FSH, and luteinizing hormone, LH. And both of these hormones work together in the follicular phase, helping your body recruit and develop your follicle in a natural cycle. Say you might have one mature follicle that becomes the one mature egg that you ovulate. So when your doctors are prescribing medications, when they're prescribing particularly Menipure, it contains both FSH and LH. And since that is something that is strategically happening in the body naturally, we're sometimes trying to help replicate that with your medicated cycle, so that the body recognizes that and it can take in those two hormones and be able to then recruit and develop the multiple eggs. So the biggest thing is why it's technically not an FSH alone product is it's combining the two hormones of FSH and LH. Sometimes what I will say, depending upon, again, age, diagnosis, history, going into the practice with what your gynecological history is, et cetera, some people might do best with a pure FSH type of cycle, where some medications are pure FSH and there may not be a need for an LH product combined with that. Or it may be that, yes, you need the combination. So as I stated in the beginning, in the intro, we're all fertility patients when you're walking through the door when we see you. However, how we treat you is definitely individualized plans. So, we are looking at the individual to come up with which combination of drugs would best be suited. But with this product, Menipure, it does contain the FSH and the LH, which we do have those two hormones in our bodies. And what we're trying to do when we're utilizing this product is we are trying to have a little bit of that LH added. Yes, it has FSH, but we're usually adding this sometimes in combination with an FSH-only product, possibly. But again, a lot of that's going to depend on the diagnosis of the patient to get the right combination of medications that may be the best for you. But main goal, think multiple eggs, multiple follicles, that this is the one that's super ovulating those ovaries and producing multiple eggs.
Thank you for explaining that. And I think it's great for people to know that there are a lot of different options on the table, and also a lot of things that are going on during the cycle in general. So there's a lot of moving parts. And so we're trying to use everything at our disposal to make sure that we can get you to that, like you said, that end game that you want to get to with that pregnancy. So great to help people understand why the multiple shots. Well, there's a reason. There's a reason for every single one of them. And that's what we're here to talk about. So perfect. So this question, which is, coming off the weekend right out of Thanksgiving, and we're basically, knee deep at this point into the holiday season, but also winter is upon us and the crazy weather that we're experiencing. So I thought this was, a perfect time to bring up this question that comes in saying, so what is the best way to store my Menipure in between doses? Does it need to be refrigerated? How about if I'm traveling during the holidays? Does that change anything?
The nice thing about Menipure, the easy thing that I would say about Menipure in terms of storage, is you do not need to worry about refrigeration. It is one of those medications that you can be traveling with it and not necessarily have to worry about having it on an ice pack or in a lunch bag, which some medications, if they require refrigeration, that's usually our little trick to say is think of it like you're bringing a little bag into work with your lunch or your breakfast or what have you. You can put a little ice pack in, an insulated bag, and then put the medication in there. That's one way to travel with it, because that's one way that some of the medications, what you'll find, especially like from Mandel's clinical pharmacy, is that your products oftentimes may come in with some ice packs, and it's to keeping things cool. But with the cooler temperatures, I'm just wanting to let you know, you don't have to worry with this one. It is room temperature stored. So there's no worry about, oh my goodness, something's going to happen to it. If I don't get home and get that package right away and put it in the refrigerator. This medication is a room temperature. So that makes it easy for storage purposes and traveling with it.
Absolutely. No, thanks. And one of the things I know that we do quite a bit at Mandel's is help with those types of questions about, what needs to be stored in what different in what different way, and to make sure that you know how everything is. It's one of the reasons why we also say to, when you get the package, to open it up right away and get a chance to take everything out and see how everything needs to be stored and what needs to be put where. And then there's always, obviously, you can call the pharmacy and ask if you have those questions. So we're trying to really partner up, between the pharmacy itself and you at the clinic and the patient. The three of us are kind of that trinity that are working together to try to get the patients pregnant, and to really be there for you to help you get through this process. So to feel free and comfortable to reach out when you have questions like this, we can definitely help. So thank you very much for remembering us on that one, Wanda. How about this one? So this one is a little bit more in the actual utilization of the medication. So it says, why does Menipure have a Q cap and isn't just mixed like any of the other medications that I've seen at the fertility level?
That's a good question. And what's nice about this is that, a Q cap was developed by the product maker because the little vials, they are tiny. And sometimes there are male partners that might be involved in mixing, and they have bigger hands than sometimes us ladies. And so what I find, and not that this is the only reason if it's a male partner, because there does not have to be a male partner, but that could be one of the things to think about, is that those vials are sort of little and they're difficult. And if you're using a needle to mix, that's not improper. Some people say, "Ooh, I didn't know to use the Q cap," or "I didn't see the video, and now that I'm glad I saw that." It's okay to sometimes use needles with vials, but why the product maker made that for this particular product is to make it easier. And I personally find as a clinician, with having worked with vials years ago, being on the nursing floor in a hospital and handling medications and using sometimes needles, it really is nice. It's a nice, I think, safe measure for patients to be able to mix the product with relative ease. I feel like you are able to get all the fluid nicely with a Q cap. I feel like there's no worry that sometimes you have the needle in the vial and sometimes the needle comes out because you forget how long the needle is really if you're using a needle, and that can be a little confusing. But again, to preface it, I'm not saying needles are incorrect with vials. You absolutely will have some medications that you're using needles with, but with the Q cap, that product maker did a nice job at coming up with something that can really help that ease of administration and not using a needle and getting all the liquid and whatnot. So I find as a clinician, I really like the Q cap. So I always try to make sure that if patients are having trouble with mixing Menipure, sometimes one of my first questions is to ask, are you indeed using the Q cap? And sometimes they may not have watched a video to know what it was for, so they just were using needles. So oftentimes once they do a Q cap, they feel better too.
Perfect. And I feel like, I guess it's probably my responsibility to apologize on behalf of the male partners for their large hands. So sorry that they had to create an entire product specifically so that they could figure out how to do it.
The guys are doing the mixing. It becomes everybody helps each other out there.
Exactly. No, and it's the reason why it's great to mention that is because some of the great parts about these videos are that we have not just the full thing, as you mentioned before, but also those mini individual, just the product videos. And the great thing about that is if you have like a partner who maybe isn't with you right now watching this whole video, but You want to be able to show them right before you're about to sit down. It's the moment of truth and you're about to give the shot, and you don't want to watch the full thing, but you want to just get right to the point, no pun intended, of the shot you're giving. You can just watch that video. So just another little reminder that on our PharmAssist page, and we'll get through all that information. We'll make sure you have all of the different sites where you can go, the PharmAssist page itself, as well as our YouTube page, to be able to check out these videos. So thank you for mentioning that, because it reminded me to say that.
Absolutely.
So,
absolutely.
Perfect. All right. So at this time right now, it looks like we're all caught up with questions.
Okay.
I do want to give people another 30 seconds or so. If you are trying to, you're trying with your large hands, guys. Sorry, you're trying to type and you can't get in. So I'm not gonna I'll let that go now. But if you're trying to type it in and you haven't gotten a chance to yet, we will give you another 30 seconds to get it in there. But in the meantime, don't forget to, if we move on to the next product and you think of another question, you can certainly bring it up at the next product, and we will answer any questions we have. But in the meantime, I will throw it back over to you, Wanda, while we are giving people some time with their questions.
Okay. So with the Menipure, just to wrap that up, it's one of the mixing medications. It's part of your recruitment of your follicles, in that follicular recruitment part of your cycle, and it is what we call a subcutaneous injection, a tiny needle, little short needle. So anytime you're using a shorter needle, that means the medication is absorbed in that fatty tissue, and so that's where that medication goes. Always know that your fertility healthcare provider, your fertility clinic, your nurse, your doctor team, they will provide you the name of a drug that you might be taking, which again could be a Menipure. The dosage that you need, which I showed in the video, might be a dosage of mixing 1 powder versus 2 powders versus 3 powders, which I always like to show that, because I always get that question of, does that mean I have to take 3 shots or 2 shots? And my little thing that I always use with that is that if we all walked into Dunkin' Donuts and all got a small coffee, but I get 1 sugar, Craig gets 2 sugars, somebody else gets 3 sugars, it's still a small coffee. The volume of the coffee doesn't change, just the sweetness of the coffee. So in terms of the Menipure, however many powders you're taking, it's just the dosage that is specific to you. So you can think about my coffee analogy maybe with that one when you're working with that.
I 100% did not expect to hear any reference to Dunkin' Donuts tonight, so well done.
Oh, I'm here with mine.
I like it. There you go. It's perfect. So it looks like we're all caught up right now. So at this point, it's probably time we can move on to the next one. Okay. But again, if you have any more questions, feel free. We will definitely get to any and all questions. So whenever you're ready.
All righty. The next medication that we're going to do a video for you to take a peek at is called Ovidrol. Ovidrol is a medication that is used to ovulate you within your cycle, whether it be for intrauterine insemination or for an IVF egg retrieval. So its purpose is to induce an ovulation. Ovidrol, like the Menipure that you just saw, is once again also a little tiny needle. So it's a subcutaneous injection that you'll see that goes in the belly or the upper top thigh area. And Ovidrol is sometimes given, you could be taking 1 injection of it. You could be potentially doing 2 separate injections of it. This one is not a mixing drug. This one you will see in the video is a pre-filled syringe that is already mixed. Simply put, you would be guided if this is your product to take, and you would be guided of if you're taking 1 shot of it, 2 shots of it, and which days and when you're taking it. Your clinic will give you that. But the basics of the Ovidrol shot, if Craig is ready, we're going to take a look at that video to help you through that medication. The first medication that we're going to review for your fertility cycle is Ovidrol. Ovidrol is a medication that is used for ovulation. It either prepares you for possibly an egg retrieval, or it prepares you for an intrauterine insemination. And it just depends on which center and clinic you're working with as to which medication they use to help with that ovulation. But Ovidrol, just first off, just so you know what you're going to need, my biggest thing with Ovidrol or any of the medications in teaching is just to tell you what supplies you need before you get started. So just a little sheet here is letting you know that the supplies you need for Ovidrol is 1 pre-filled syringe of Ovidrol. It's nice and simple. That's only 1 item that you need. So to start out with this medication for ovulation is really easy for patients typically to use, and hopefully it'll be easy for you too. The nurse and me, the other part of this is very important that you know that doing a medication is not a sterile technique, but it is a clean technique. So once you get your box of Ovidrol and you're preparing yourself to prepare for the injection, what I want you to know is just go and wash your hands first, or if you have a little bit of bacteriostatic hand sanitizer, what I want you to know is just either way, it's just good to start off with clean hands, okay? This medication, like I said, is for ovulation, but the other thing that I want you to know about it is that it is a subcutaneous injection, which means it just goes into the fatty tissue, which is good because that's a small needle, and usually those are easier to sometimes tolerate for patients because they're a little bit easier to administer, and literally the pinch you feel is like a mosquito bite. So to give you something that you've already done, possibly to make this seem not so daunting, is if you've had blood drawn, you have done something more evasive than this injection. Little injections are a little pinch. That's literally all they are in the skin. So first off, when you open up your box of Ovidrol, what you're going to find in there is your syringe is going to be pre-filled, pre-dosed, ready to go. So as far as for patients go, this is one of the easier type of medications we could have you take for your fertility cycle because all you're doing is injecting. And we would always guide you at the center, your center, wherever you may be, with when you need to take it and what time, if there's any sort of time requirement for you with your center. So let me just open that. There we go. In the box is a syringe. You'll see it's pre-filled with liquid. That liquid is ready to inject. That's the medication. So simply, sometimes what you might see that people hear about is bubbles, and if you're worrying about any bubbles, you just give a little snap to the syringe and the air bubble rises to the top. I kind of I sometimes discourage short of shooting liquid out because that is precious medicine to your cycle, so I don't want you to lose anything. So it's okay if you do a little bit of push with the syringe, but just be very, very careful if you do that. So I'm not going to uncap it yet because I want to show you where this injection goes. And with the help of my injection mannequin, what I want to show you is for this injection, typically you're going to use the lower abdomen, lower belly below the belly button. And when you take this, this is a one-time shot, so it can go anywhere in this belly. The other area to use are your upper thighs or outer thighs, because again, this is a fatty shot, so it just needs to get into that subcutaneous tissue. This injection can either be self-injected or you could have somebody give it to you. So what I'm going to do here is actually, if I were self-injecting and I was standing, and this is my body as the mannequin would be here, I just want you to see that the needle would go in at a 90-degree angle. The other part of this type of shot is that you pinch the skin just a little bit when you administer it because you want to make sure that you're getting into the fatty tissue. So first thing we do to that area is we clean it with alcohol. Just get a good little clean there. Next step we do is we can uncap the needle. Just be careful. Put that cap down. And here's where I said that if you did a gentle little push-up with the liquid, if it comes out, you can do that, but you want to gently push that up and create a little bubble, and that bubble or a little release of liquid, and that's fine. And then what we're going to do is we would pinch the skin in this belly, and we don't have to jab. Place the needle gently to the skin, insert the needle all the way, let go of the fatty pinch, push the medicine all the way in, count to 1, 2, 3, and then release and take out that syringe. And you can put a little cotton ball there. You might get a little bit of the fluid from the medication or possibly a little bit of bleeding that you could have as well, but that's fine. That's what you should notice. The bleeding would go away pretty quickly. So with this medication, what you want to know about the injection is it's very quick. It goes in quickly. It's a little pinch when it goes in. And Ovidrol doesn't typically sting. Some medications can, and we'll talk about that if we have any. but just for this medication particularly, it's not usual that you'll find that it stings. Hopefully this has helped you to see how to work with your Ovidrol medication, and I wish you the best of luck with your cycle. So as you can see, the Ovidrol is slightly different than the Menipure injection. Different reason that you're taking it. What they're similar in is their injection technique, but the Ovidrol specifically is for ovulation. Once you've taken a drug like Menipure, you would then be using possibly an Ovidrol shot as a way to ovulate and help prepare the follicles, the eggs, for ovulation, and timing that with a procedure such as an intrauterine insemination or an IVF egg retrieval. I think that's pretty much what I would say as far as my added comments to it. I don't know, Craig, if we had some specific questions for this. I would keep saying question and answers. I'm going to answer the questions.
Right.
But, in any event, it's kind of nice to have those two shown together because obviously the technique is similar. So it's nice to show that some medications share technique, which is good.
Right. Definitely allows people to get more to get even more comfortable with everything when there's some comparable medication injections there. So great. And I guess if people want to write in with both a question and an answer, if they're just informing us, then that's great too. I guess we learned something today, so there's nothing wrong with that. All right, so a question did come in, and I'm going to say up front, based on this question, I'm hoping that this is maybe just it's a bit of a hypothetical situation, but I guess we can treat it as if it's not, because it says, "Help! I missed my shot scheduled time. What can I do? Am I totally out of luck?"
You missed your shot schedule time. So first thing I would say is definitely contact your healthcare provider or your clinic. We do, and we have had some situations where sometimes a patient might have an issue with, if this was a medication that you were told to take at a specific time, as long as you get that information to your clinic, typically like our clinic, I know we can sometimes adjust whatever we need to take care of if it's being timed with a procedure. The variation in that will depend really upon the procedure. If you're doing an intrauterine insemination, you have some flexibility and you're usually given a time frame, not a specific time of when to take that medication, because that's something where you're coming in and having an office procedure. It's done in the office, such as an intrauterine insemination. And so there's a range of time to perform an intrauterine insemination after the Ovidrol injection. There's an optimum time frame for the peak of that drug. So your doctors will use in their clinics the timing of that. And that's why you usually have a range of time with that. If it's being timed with a specific procedure, such as an egg retrieval, which is something that usually isn't done in the office per se, but done more in an OR where we require anesthesia. And typically there's one retrieval maybe happening at a time, and your time was specific to you for your procedure, just let us know. Again, usually the biggest thing is to communicate that. I can't emphasize it more. Communicate that to your clinic. There's oftentimes the clinics might have an on-call system where either a physician or a nurse or both are on call. So even though the hours of the office have closed down for the day, there is somebody on call to reach out to. And I think the biggest thing is just letting us know, because we can't address something if we're not aware, but awareness is key. So just communicating is the best way I can say for your clinic to be aware, and then they can troubleshoot.
Perfect. Thank you. Because one of the things is, based on the way the email was written, or the question was written, like, you think that there's a bit of a panic there, and it's understandably so with one that's so timing focused. But I think one of the best things that people can feel is that comfort that there's options on the table, and that you, as long as you're aware and you know how to handle the situation, that's the second most important thing. Probably the most important thing is just do your best to not miss it in the first place.
Exactly.
When your nurse, when there's one medication where your nurse gives you a very specific time, try to stick to that time. There's a reason why. But it's also great to know if you have to have a fallback, to know that you can reach out and figure out the next step. So
we'll tell people with their phones to set a little alarm, because sometimes they're taking a shot that's a little later at night. You might get drowsy and fall asleep, and that's okay. But you want to be able to just know you're taking care of that. You set it anyway, even if you don't need it,
Exactly. That's great. Perfect. Now, using the technology at your fingertips, you might as well, because it's taking over anyway. So sounds good. All right. So now this one is just a little bit more on the kind of the makeup of Ovidrol versus some of the other medications that we have out there. And the question just says, can you explain again how Ovidrol is different than other types of HCG? Sorry, I hear them all referred to as a trigger shot, but I'm just not sure what the differences may be.
With Ovidrol, as you saw via the video, that is a pre-filled syringe and it is a subcutaneous injection. HCG, which comes in different trade names, could be Pregnil, which we have videos for, or Novarel. Those are other forms of trigger shot HCG. Those are like the Menipure. They are powdered vials and they need to be mixed. And that particular product can be either a subcutaneous injection, like the Ovidrol, or it could be an intramuscular shot. The biggest difference I would say with each of those is whether you're doing a formal HCG, which is a mixing product, whether it's the trade name Pregnil, Novarel, or this Ovidrol, which is pre-filled, is the concentration of the HCG in them. They're all could be a little bit different, meaning that some of those powders, when you mix them, are 10,000 international units. Some of those powders, if you're mixing them, are 5,000 international units as supplied by the manufacturer. And with Ovidrol, I want to say, I believe, I mean, don't quote me to it, but I think it's around like 6,500 international units. So what you want to know is that because of that, depending upon your cycle, it may be that your doctor is going to have you take a specific amount that is best for your body. So again, as Craig has even said, and I've said probably a couple times as well, there are options and we need options because again, not every fertility patient is the same just because you're going through a fertility cycle. You are an individualized patient with your own treatment cycle. And so each of these HCGs or these trigger shots, could be a little bit different based on how they're administered, subcutaneous or intramuscular, mixing, no mixing. But I think the biggest thing I would say to every one of us with medications is dosage. If I have hypertension, I may be on a lower dose drug because that's what I need for my body, but somebody else may not be needing my dosage and they may need what they need for their hypertension. So with fertility, even with that trigger shot, there may be a need to give you a specific type of, or I should say a specific amount of drug. And each of those drugs is different depending upon how you mix it. So that's the key to know that is sometimes if we need you to even take a little less than a 5,000 unit shot of that, allowing us to show you how to mix that and then take out just a very small amount lowers the amount that you're injecting. So I think the key is dosage, dosage, dosage. That's how it's determined which of these trigger shots might be best for you.
And that's great. Well, speaking of individual, the specific to the patient type of an idea, this question comes in actually asking a little bit about different ways to maybe individualize the injection. And it says, where can I give the Ovidrol injection? Can you remind me again? I feel like most of my injections have been done in the belly, so any alternatives would be appreciated.
So as I showed in the video there with the technique for subcutaneous for fertility, generally we have you inject in either belly, lower abdomen, but if that's getting a little tender, a little sore, it's okay to utilize the upper top thigh or the side upper outer thigh. And you might say, well, why not my lower thigh? Because most of us probably have quadricep muscle there. So we do have fatty tissue over our muscle, but it could get a little sore even with that little needle if it's getting slightly into some fatty tissue and muscle tissue. And the main thing with muscle tissue is just when we get an injection in muscle tissue, it just feels a little sore, little tender, almost like a slight bruise sensation. Or like even when you go and work out at the gym and your muscle feels a little achy. That's sometimes what you can get from a muscle medication if it goes in the muscle. So it's not horrible. It's not anything intolerable by us as patients. However, with this particular injection, it's a fatty tissue. So when it goes into the fatty tissue, even like an hour or two after, typically if you rub that area of that fatty tissue, you won't even be able to know sometimes where you've gone and given that injection. So that's the key is sometimes you really don't feel these fatty tissue shots. But if your belly area is sensitive, just know it's okay to switch it up and use the right leg, the left leg, and the top outer thigh or the top thigh, and you're going to pinch to get that fat up off of any muscle. So that's what's helpful, is you can definitely rotate the sites.
Great. Thank you so much. And I think these are all the things that really help people is getting prepared, is knowing that there's options on the table again. And we keep harping on that, because part of that, the importance of that, is that there also means that there's going to be a lot of questions. When you have options, you have questions about those options. So that's what we're here for. And that's what this program is for, so that you can ask those questions now, so you don't have to worry about them later. So with that being said, as of right now, we are all caught up with the questions. So just as always, we'll give another 30 seconds for people to get them typed in. In the meantime, I will throw it back over to you, Wanda, to share anything you want to give people a few minutes to get something in there.
I would say the biggest thing was that good question about somebody feeling a little panicked over or asking, oh my gosh, help if I, mess up my time or whatever. I would just want you to know that with any of your medications, we are all here to help. Your nurses and you particularly do a lot of teaching with medications, and we're probably the primary contact that you are speaking to, as well as the pharmacy staff at Mandel's Pharmacy. And so what we want you to know is that we're all working as a team, and there's no stupid question to ever ask about a medication. Or needing to be reminded about storage, or where is it given again, or what is this for? I think it's always good to have the knowledge. These medications are going into your body, and it's good to understand what's going on. It puts you at ease and helps you to feel sometimes a bit more in control of a situation that we know is not always in your control. And that's the hardest part about fertility, is that it is a little bit of letting go and allowing us to do what we do best, which is to guide you with what we know best. And but we are always here to hear it out and hear what you have to say, and if there's a problem that you're having. So there's so many resources, and that's what I think the biggest thing to get from this video learning experience is there are resources for you, and we want you to know that we're here. And call us, let us know, talk to us, and we will do whatever we can to help you through it.
Thank you very, very much for that. I think it's great, and really just embodies everything that we're about here. So thanks for sharing that. In the meantime, we have actually no more questions at this time. So as always, we are ready to move on to the next product. But if you think of questions from either one of the first two products, we will certainly get to them. But I will throw it back over to you to introduce the next product.
Gonal-F multidose is the next medication that we are going to see a video on. Interestingly, that it's falling in line with a Menipure and a Ovidrol shot regimen tonight, because like those two medications, the Gonal-F multidose is a subcutaneous injection, tiny needle in the belly or the thigh. So all three shots tonight, same injection area. Gonal-F multidose resembles Menipure, the first video you saw, because it is a vial, and it will have some powder in there, and then there will be a need to mix. But like Ovidrol, once you've mixed it, then you'll be able to use it. In the case of the Gonal-F multidose, you might be using the one bottle for more than one dosage, which is why it's called multidose. So like the Ovidrol, where it's pre-filled, ready to go, once you mix that Gonal-F multidose, it's pre-mixed now, or you've now mixed it, and it's ready to go, and you might use from that one bottle until it goes empty, and then you just mix a new vial. So it kind of is a combination of the two of the previous videos that we just had shown. So Gonal-F multidose, though, like Menipure, contains pure FSH, the follicle stimulating hormone, which is then, when you hear that buzzword FSH, that just means stimulating multiple follicles to grow. So you're usually taking this as that medication that's recruiting the eggs prior to the egg retrieval, prior to the intrauterine insemination. It's preparing the body to have those multiple follicles to prepare to release or capture during a egg retrieval. So I will let Craig bring that video up and we can take a look at it, and then we'll come back for some questions to see how that goes for you. This video is to help you with the multi-dose Gonal-F with mixing and administration. If you've been prescribed multi-dose Gonal-F, Gonal-F is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue, so that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonal-F, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, finishing it off is this injection syringe, which is a Gonal-F 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click. And then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe. because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, Just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and the nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject, though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it's occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there, and with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently. set it down, and then you'll put a little pressure there just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the syringe, several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using two separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it doesn't have to be two shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay. So I hope that video helps you to understand the multi-dose Gonal-f product, and best of luck with you in getting started on your injection journey. That video was great to show after doing the Menipure and the Ovidrol, because it's sort of a combination of both of those, and I think that was nice timing with where that fell into place there. But as you can see with the Gonal-f, it's a one-time mixed vial that you'll mix, but using maybe several times that one vial, which is nice because then you're not mixing each time, which is a little bit easier. And then whatever you need, if you need to still continue, you will have more than one vial of that multi-dose. But again, it's just like that Menipure and that Ovidrol, with being a tiny subcutaneous injection, which is also nice because these are all little tiny shots that you could self-inject if you were comfortable, but you also can have someone administer the shots to you, so you have that as an option as well. I don't know, Craig, if we have any questions there.
Yeah, actually we do. So there's a question that came in, and this is one thing that we also like to help out about, is just talk a little bit about some of the financial situations at hand. We understand there's a lot that's going into this, and both emotionally and financially. And so if we can help people understand what their options are, that's really what Mandel's is all about, and the PharmAssist program is a big part of that. And so this question came in, and we get this quite often, but I've read that the overfill with Gonal-f vials can help me save quite a bit of money. Can you please explain that a bit more in depth so I understand how it can help me save money utilizing the vial?
So with your multi-dose vial, it will typically state that there are 450 units, for example, from that one vial. But when you do mix it, there will always be what they call, then there becomes a little bit of overfill. And with that overfill, they do that, like if you saw in my video where I might have squirted a little bit out, it's just, they want to reassure you that you will absolutely be able to achieve drawing up 450 units in total from that vial. But by putting a little extra in there, in case you ever have that issue where something squirts, you don't have to panic, because you'll know you definitely can get the 450. But in addition, you just want to simply draw up, as I used the example of, if I have a little extra in there, at the bitter end of that vial, I don't want to say, oh, well, there's not enough from my whole shot, I'm just going to open up a brand new one, because you may not have never needed to open that brand new one. But the issue becomes is that you want to draw up and just finish every vial, to the end once you have opened it, if that's the case, before you move on to the next one. So that's kind of what it means, is that saves you a little bit in having to open up a new vial. Whereas you can hold on to that vial. Sometimes some people might be doing multiple cycles of IVF for their reason, their type of cycle that they're doing, so they can hold on to it, because usually the expiration dates of the medications are pretty long once it's dispensed to you, whatever the packaging states on there, as long as it's unopened. So that's another way to save yourself from tapping into a brand new vial if you don't need it at that moment. And you're using everything that you're getting from the other vial as well and not wasting.
Absolutely. And I think one of the things that just be remiss not to mention that part of what we do all the time at Mandel's is we make sure that any financial programs, any discount programs that you can qualify for, we will make sure that you do qualify for, and then we will get you into them. So if there's something there that works for you and that you will qualify for, you don't have to work for it. We'll do all the heavy lifting for you to make sure that you get into it. So that's a great thing when you're talking about saving money using overfill. People are really trying to think bigger picture. How can I save enough money in case I do, potentially have to go into a second cycle or even just the cost of one cycle alone. That's really our goal here, is to make sure that any program that you can use, we will make sure that we notify you and get you into, so you can save money wherever you possibly can. So that's a big focus for Mandel. So thanks for bringing that up. So this question probably came up similarly because of the question that we asked earlier, but kind of a similar one. How should I store my vial between dosages? With the winter upon us and hopefully possibly travel, there's a little smiley face there. So hopefully somebody's hoping they'll be able to travel during this winter season. Do I need to worry about refrigeration or storage on the road? Can the cold become a problem as well?
With your multi-dose Gonal-F, I did mention in that video when you did mix it that you could keep it in the refrigerator, but it doesn't necessarily have to be, because you're probably going to be using it pretty quickly within the cycle. So the nice thing is when it's not opened, it definitely can just be stored at room temperature, which that makes it easy for traveling, etc. And so any worry about the cold temperatures and all of that, you wouldn't have to worry if it was, it refrigerated or not, because you can keep it and store that at a room temperature. So as far as traveling, whenever there is a medication, as I said previously in the evening, that if you do have to travel and something needs to be kept a little cool, again, you could just have a little insulated bag with a cold pack in there, and that'll keep whatever you have in there kept cool if it needs to be. So sometimes these are questions that the pharmacy can very much answer for you. If you're trying to get through to your nurse and you're traveling and she hasn't called you back, it's always we always encourage you guys to know that we rely on the pharmacies as well sometimes to make sure we're informing you of some proper storage directions. So just know that Mandel's Pharmacy is there as a resource. If for some reason your nurse hadn't returned your call yet and you have that question for her, just don't worry. You can have us all as resources to ask. But usually this one's okay to keep, like I said, at room temperature.
Yep, perfect. Thank you. And thanks again for reminding everyone that they can reach out to the pharmacy. We do work in tandem with you guys to make sure that that information is there and that the patients know. And, now it doesn't feel like that long ago over the summer we were saying, hey, you don't have to worry about, keeping everything cool, and we help keep the heat with these non-refrigerated. And now we're like, hey, don't have to worry about, them getting too cold by being in refrigeration and then freezing, because they don't need to be refrigerated. So there's always a big part of what we do is make sure that patients are aware of all this. So great. Thank you so much for mentioning that. Yep. And it brings me to the last question, which that we have so far. Obviously, plenty of time if people want to ask, but the last question that came in just mentioned, this is more the kind of big picture that we talked about before. And it says, what does FSH actually do, and how long will I plan to be on this medication?
The FSH product of multi-dose Gonal-F, as well as what Menipure is, even though that was FSH and LH, but those two products are used in the stimulation phase or the recruitment phase of multiple follicles within your cycle. Typically, on average, and I will just say what my experience is as a nurse with our clinic is, on average, you're on either of those two medications for approximately 7 to 10 days. Could it be a little bit less than 7 and be 6 days? It could. Could it be that I'm on at 11, 12 days? It could. So I guess if we look at all fertility patients, there's an average, and the average is a range of time. So anywhere between a week to 10 days, give or take, is the average time frame that it might take you to be on that medication of multi-dose Gonal-F. So usually what your nurses will make certain when they order the prescription through a pharmacy, a clinical pharmacy like Mandel's Pharmacy, is we will order you a 7 to 10 day dosage with refills. And if we ever see that we're increasing your dosage, what that could mean is that you might need to tap into those refills. So it's real important for us that we will remind you of that. If we see that you're going to be on it maybe for 12 days, we ordered you a 10-day supply and your dosage has increased a little bit. So we're always going to work with you. And it's always something where you will be sometimes asked to call the pharmacy. We put refills on there. And so your pharmacy really is a big person to communicate with when it comes to getting those refills that you might need, because the timing of this is we try to give an average dosage and then give you what we think it will take, but there are times that you fall outside of that average and we might have to have you have more medication, but that's the reason for the refills. That's the reason, as most clinics will do, is they will put the refills on there and just say, hey, yep, now's the time to call the pharmacy and obtain your refills for that medication if you're taking a few extra days over the 10 or, and it's 11 or 12 days, which is fine. So we will definitely let you know. But usually on average, it's 7 to 10 days for that multi-dose Gonal-F and even the Menipure.
Oh. I just did it. See, I did it. I forgot to unmute as well.
That's because you were sipping your drink.
Your water
bottle.
Exactly. You have to stay hydrated, right? So,
yeah, you have to wet your whistle. Absolutely.
Exactly. So that is our last question as of right now. And okay. I just wanted to, again, give everyone out there, we'll give another 30 seconds to ask any questions. We're all caught up on the Gonal-F multi-dose vial, which is our last product. So now is the time if you have any questions about the Menipure or the Ovidrol or obviously the Gonal-F multi-dose, feel free to get them in. And in the meantime, as always, Wanda, I will throw it back over to you to give people another second to get those questions in.
Okay. To be honest with you, what I wanted to just take a minute to do so I don't forget, because sometimes I forget when Craig sends me off. I'm a big believer in trying to use some wellness tips for you guys to help alleviate the anxiety that you might have in starting your cycle. I'm a certified healing touch practitioner, which means I do energy work, and we are multidimensional beings. And this is a challenge. And as I have a window to my right, so as I was sitting here and I was listening to the thunder and watching the sky light up, and I said to Craig, oh my gosh, what if the power goes out? The show will go on. And so I kind of was relating that to what you might be going through or feeling that this is a challenging time. And I wanted you to know that, we just finished a season of Thanksgiving, giving thanks. And I think gratitude is a real big part of mental health and well-being. I think it's one of those things that can have a deep and a lasting impact on our well-being if we stay in a state of gratitude. And I know that's not always easy when you're challenged with your fertility journey. So little tips I could say is create maybe a little gratitude jar where each day you write a little something you're grateful for and on a little piece of paper and drop it in that jar. And then you'd be surprised later on when you look at that jar couple months later and take a look at what you were grateful for back 2 months ago. Do a little gratitude journaling, little gratitude meditation, trying to find the positive meaning in why you're going through this experience, this fertility journey as you embark upon that. Just to share something for you with my own, or something to say is that once you are done with this journey, you might be a pro in injection technique. And you might be confronted with another fertility patient in your path who could use your assistance. They could use your words of wisdom. You went through this, so you could be a positive force and a positive impact in them because you can say, you know what, it really isn't so bad. I got through it. I got through those injections. So that's something to keep in mind. I became a nurse because in 8th grade, I had a basketball accident where I went up for a jump ball and I sprained my ankle horribly. Could not walk on it for about 8 to 12 weeks. And that was not a great situation. I mean, I know I was only in 8th grade, but that was a big deal to me. I had to sit in a room and be all by myself, taking my classes. It was not fun. But what I'll never forget is when I went to the ER, the nurse that unwrapped my ankle and looked at it went, oh my gosh, look at that. It looks awful. I was only 13, 14. You can only imagine how scared that made me. So I always decided at that point that if I were to embark in this field, I would never want to make somebody feel scared like that because it certainly made me scared, those comments. And I know she didn't mean any harm in that, So that's just my little story on that one little event. I think back to now when I'm a nurse and I want to help alleviate anyone feeling scared or nervous over something. And I try not to have those reactions to anything because I want to keep it in check. So I think that I would just want to say to you, I know this may be a challenge, but it's okay to feel that way, but just know that you will become a pro with your medications, especially through the video learning experience. And I just wanted to add that little personal touch to keep that in mind for you, to hopefully maybe you can equate that with your journey as you begin. But think about somewhere down the line, there could be a positive lining that could come out of that if you're approached by somebody who becomes a fertility patient that may need your help, because you're the expert after this.
That's excellent. Thank you very much. I think everybody right now during this time of year, it's great to end every day on the positive and have that positive thought. I think that's probably helpful for all of us, not just going through the fertility situation, but in the wider, in the wider thing of life, especially with the holiday season. So thank you so much for that little positive affirmation there at the end. And with that being said, it does look like we are all good. We are all the questions that we were able to get today. So with that being said, I will give it over to you to start wrapping things up.
Okie dokie. So reminder about this evening's videos. They are on the every Monday night at 7 p.m. There is the Facebook page, the live event, Zoom, YouTube, and you can also, they're all archived onto a video learning experience library at mymandels.com/PharmAssist. And know that those different videos are there for you for whichever products are a part of your cycle. And those products will come to you by your fertility center. And the main thing I would say is that know that your clinic and your pharmacy always are working hand in hand. And so we are all here as resources for you to be able to call up and, check in with us and ask us at any time, whatever it may be that you need in order to help your journey with your medications. And know that, as I always said, and I said it in one of the videos, fertility cycles have a beginning and an end. They are not forever that you're on these injections. There's just a short period of time, but there will be a beginning to the shots and an end to the shots. And then that goal of pregnancy is really our goal for everybody.
Great. Thank you so much. I really want to say thank you, Wanda, for all of your time and your expertise tonight, all of your very comfortable way of describing all of the processes that people are going to go through, but also answering these questions. And to really, that's our goal, is to make sure that people feel not only confident, but comfortable throughout this process. So thank you very much for doing that. Thank you to everybody back home, whoever's watching us via your Zoom or your Facebook Live, for sharing all of your excellent questions. They were all incredible. And we definitely hope that you were able to learn something from us tonight, because we definitely got some great questions to spark some really great conversations. As Wanda just mentioned, we don't want to forget that all the full virtual learning experience videos are available on all of our different pages, as well as the individual videos themselves. So if you just want to watch those, again, a reminder that you can catch that on our YouTube page, right here on your Facebook page, if that's where you're watching it. These are archived, as well as our mymandelsPharmacy.com/PharmAssist. That page will take you to where you'll see breakdowns. You can see, here's the different full VLE, or you can also check out the individual programs. As always, we look forward to seeing you here all again next Monday night at 7 p.m. Eastern Standard for another great program. We will be joined by another excellent speaker. And I do want to say, in the age of the internet and with everything, that's going on right now, the number one way that these things people can find out about these different types of programs is to share. So if you know a family member, a friend, a colleague, somebody standing next to you at Target who happened to mention it and you want to share with them, please feel free to share the PharmAssist program. That's the way people find out about it. That's the way more people will know about it. And that's the way we can continue to put on this great program for all of you. So we do want to say, please share this program. Let them know, let people know that you're thinking of them. It's the greatest way to, share your thoughts during the holiday season. And again, thank you so much, Wanda. I look forward to seeing you on here again. Thank you, everybody back home watching this, and good night. We will see you next week.
Thanks, everybody.
The PharmAssist
Have a great
program.
night.